Hi, my name is Vanessa Sarkozy. I'm a developmental paediatrician at Sydney Children's Hospital in Randwick, and I'm currently head of department at Tumberton, which is the child development service based there. What the families need across all chronic disorders is a tiered approach. So they need to have a general practice who has that overview of the child, overview of the family, who understands the history and is then able to pull in additional specialist resources as and when required. I think that's the best use of health resources, but I also think it's the most appropriate model of care for families. It means they can rapidly access care when they have concerns, they have confidence in their GP, and their GP has a mechanism for pulling in additional resources or support as required. I think there are two populations. There's the population that really knows their GP, and their GP is their care coordinator. And then there is a population who doesn't have that relationship with a GP. And I think they have very different models of care. And that perception that the paediatrician or the specialist is the person that manages that disorder becomes more and more entrenched over time. I think the much more optimal model is that the care coordinator is the general practitioner who then pulls in additional resources as required. And as specialists, we reinforce that idea that the GP is the first port of call, and if the GP is worried, they can contact us and we can escalate that way. Families with children with disabilities are often highly stressed. We know that family relationship and breakdown is much more common in families where there is a child with a chronic health disorder or a disability. Having care for the whole family means that I think that the child gets better care. So having someone who understands what's happening with the sibling who maybe has developed another disorder, an elderly relative, parental mental health, family breakdown, things that are not always shared with a specialist, means that the GP is in a much better position to understand the dynamics, what's reasonable to ask of the family, the degree of stress the family's under, and when the family needs additional supports. And that may be not within my power to provide, but certainly as a paediatrician, one of the jobs you do is advocate. And I do appreciate that we have more time for that, and we have access to social workers, etc. But knowing from the GP that the family is really under stress will direct what I then decide to do with the family, or what additional resources need to be brought in to support the family. And that additional communication, that information that the GP holds that no one else has, is critical to the long-term well-being of the family unit, and therefore the child. I think GPs sit in a unique space within our system, so they are often the person the family first approaches when there's a concern about language development, learning, etc. So they're aware of the initial concerns, and in an ideal model, they would then continue to carry the family whilst we did the assessments, and if we have a definitive diagnosis, we communicate that back to the GP. The GP is aware of that, and we shift from a diagnostic phase for the family to a long-term care phase. And what I see too often, not just with general practice but also with paediatricians, is the families stop coming. They have an answer. It's very clear that the doctors can't fix it, and therefore there's no real reason to engage in healthcare. And what we know is that with routine surveillance and health promotion, certainly in adults, we found many more health disorders which we can manage, optimize health and well-being, and I believe the same is true for children. In an ideal world, that shift to managing the child as someone with a chronic disorder means that they would get annual check-ins. You would build up that comfort for the child within clinic to have their blood pressure taken, to have a look in their ears, be weighed and measured, all the things that you really need the child to be able to tolerate as an adult to be able to continue to provide that care. It also allows for early intervention when there are problems found. So I think it's important that the GP and the family understand that there are health issues associated with developmental disorders and intellectual disability, and that connection with the GP is core to the ongoing well-being of the child and family going forward. And we shift from that investigative and diagnostic phase to a long-term health promotion and surveillance phase.